Hi, my name is Eduardo Rodriguez Mieles, and I am a certified dermatologist in private practice in Guayaquil, Ecuador. As a dermatologist, I have been involved with the injection of hyaluronic acid for several years. I have tried several of major brands, and recently, a couple years ago, I made the move towards Liquidimplant. Honestly speaking, I have to share with you my experience and tell you that this brand resulted in a very safe and long-lasting alternative for my patients. Following, let me share with you a video that we prepared in order to share some techniques that I practice with liquid handling. Before introducing the cannula, make sure to expel the air from inside. In the tear throat area, I used to use Liquidimplant subcutis 0.5 cc's each side of the face. Once the skin has been properly disinfected, we draw the boundaries of the places to be injected. I personally like to numb a little bit the area to be drilled with an 23 gauge needle to avoid any kind of pain. After that, I insert the 23 gauge needle not perpendicularly but instead with an angled direction to carve a tunnel oriented in the direction of the advancing cannula. In this anatomic location, I'm going to use Liquidimplant subcutis 1 cc on each side of the face. This patient has a noticeable loss of volume of the line of the mandible, affecting the contour of her face. I define the area to be filled, emphasizing the line of the mandible where the patient has a notch. Then I draw several vectors, all starting and departing from a common point of entrance for the cannula. Very important, I localize the bead of the facial artery facing an X to avoid that area. I inject just a little bit of local anesthetic in order to minimize the pain or bleeding that I could cause while drilling the hole with my 23 gauge needle. I introduce the cannula following the vectors previously drawn, and I advance the cannula to the end, retro-injecting Liquidimplant along the lines depicted. We can clearly see the filling effect of Liquidimplant in the notch we have highlighted. We carefully retro-inject along all the other vectors, with the peace of mind of knowing that the cannula is harmless for the anatomic structures of the area. In this area, I use subcutis 1 cc each side of the face. We gently massage the area in order to get an even distribution of Liquidimplant. We use to seal the holes of entrance with band-aids. In this particular anatomic area, I prefer to use Liquidimplant Cutis
0.5 cc's on each side of the face. Now we draw the boundaries of the next area to be filled, the temporal hollow. Next, again we draw the vectors departing from a common point of entrance. As usual, I place a little bit of local anesthetic before drilling the hole of entrance for the cannula using an 23 gauge needle. And I repeat exactly the same procedure, retro-injecting liquid implant along the vectors. I must emphasize that this first vector of injection, slightly above the brow, contributes to give a little lift to the descended brow. This is ideal for the ptosis of the eyelids. In this particular anatomic area, I recommend to use liquid implant Cutis 0.5 cc's each side. We finish with a gentle massage. The patient sees the changes immediately after.
Well, I hope you found this video interesting and instructive. Let me assure you that after a couple years injecting this liquid implant brand, it has resulted in a lot of satisfaction for my patients and revenue for my practice.
My intention was to share with you a couple of non-very usual indications for the injection of hyaluronic acid fillers. In this particular video, I wanted to emphasize the art behind this practice. That's why I injected the temporal hollow area and also the mandible line. My name is Dr. Eduardo Rodriguez Mieles, dermatologist in private practice, and also current president of the Ecuadorian Association of Dermatology and Allied Sciences. Thank you very much and goodbye.